where the Prime Cabinet Secretary is making his speech in that event of commemorating World's Day. Let's cross over there and listen in.
Most of the burden of the epidemic makes the situation even trickier. Today, it is estimated that more than 33 million people in the world are living with HIV. Of these, more than 22 million live in Africa, with approximately 3,200 people dying every day from AIDS-related illnesses. Furthermore, AIDS is the leading cause of death among adolescents in Africa and the second highest cause of death among adolescents globally, according to the WHO report of 2014. It is worth noting that adolescents are the only age group where deaths due to AIDS are not decreasing. In Kenya, I am glad to note that the over 4 decades of relentless management of a pandemic that threatened the very fabric of our society has not only presented valuable lessons, but has also made us resilient to face similar challenges as they actively emerge. We are better prepared now than ever before to ensure that we do not lose the gains made in the response this far. Our national trajectory is positive, placing Kenya ahead of her peers in the region on matters HIV and AIDS. In this regard, I wish to congratulate our researchers, policy experts, programmers, and the entire spectrum of multi-sector synergy that is behind these results. As a result, Kenya occupies a space in the global arena, all for good reasons. Today, Kenya is not only a preferred destination for learning missions, but also a perfect ground for designing and launching of global HIV programs, as we have witnessed in the recent years. Ladies and gentlemen, as we speak, we have a total of 1,326,336 people living with HIV amongst us, basically 1.4 million people. Every year, Kenya requires 30 billion Kenya shillings to procure commodities for the prevention and management of HIV. As at 2024, 87% of people living with HIV were on the life-prolonging antiretroviral treatment, ART, with a PMTC coverage of 90.1%. This has had a direct effect as people are now living longer and with the virus, while HIV-positive mothers are able to deliver HIV-free babies, courtesy of technological innovations. Ladies and gentlemen, I would like to assure you of the commitment of the Kenya government to ensuring access to comprehensive prevention, care, and treatment services to all. The government has worked with different development partners and stakeholders to reduce the burden of treatment by providing antiretroviral drugs to eligible persons living with HIV. Though the cost of HIV treatment has substantially reduced, many people still lack access to the life-saving drugs. The government is doing its best to ensure that access to antiretroviral treatment is enhanced. This is part of our commitment to the global target in meeting and reducing the number of HIV cases. In this regard, we have put in place mechanisms to ensure that we acquire and roll out the latest care and treatment technologies, including injectable ART, beginning next year. This is expected to ease the pill burden that is associated with oral ART, with the accrued benefit of enhanced treatment adherence. It goes without saying, the health of a labor force underpins sustainable socioeconomic development. In recognition of this fact, we as a government have prioritized investment in the health of our people through critical interventions. Indeed, reflecting on these interventions, much progress has been made every year. Infant mortality has reduced significantly, and our people are enjoying longer, healthier lives. Ladies and gentlemen, over the last few years, my government has stayed true to its commitment to the universal health coverage agenda and has ensured that we continue to provide 100% universal health coverage for essential health services, thereby guaranteeing quality and affordable health care to all Kenyans. This is through the social health insurance coverage that brings hope to Kenyan households. We are alive to the fact that health services, if not well planned, tend to drain family resources. It is for this reason that we continue to enhance the SHI package of services to include non-communicable diseases to bring relief to the citizens. My administration will continue to ensure greater access to quality and affordable health care for all Kenyans in the spirit of the Kenyan Constitution. Fellow Kenyans, unless we mitigate its effects, HIV and AIDS will continue to have a wide socioeconomic impact that threatens development, progress in Kenya. This is particularly so because it affects the most productive and energetic, people aged between 15 and 49 years. Employees, both in the public and private sector, are affected. In view of this, the Kenya government, through the National Syndemic Diseases Control Council, has developed strategies and facilitated the right environment that allows multi-sectoral interventions and promotes public-private partnerships in addressing HIV and other syndemic diseases. This has enabled all the actors to mobilize resources, both internally and externally, for implementing HIV and AIDS prevention activities. Ladies and gentlemen, I would like to take this opportunity to thank all the partners and stakeholders from Kenya and the other countries represented here for their commitment to the aspirations of our nation and the vision of establishing a safe society where every adolescent can be accounted for. As a country, our target is to end AIDS in adolescents and teenage pregnancy as a proxy indicator to new HIV indications. This is in line with the campaign dubbed #End the Triple Threat. Teenage pregnancies are a proxy indicator of indices of sexual violence, a risk factor for HIV acquisition, and fuels inequalities. Girls who complete secondary school education have lower vulnerabilities than HIV. Teenage pregnancies impact the continuation of education for adolescent girls with negative effects on our efforts for 100% transition. Further, the high incidences of teenage pregnancies pose a significant challenge for socio-economic development. Teenage mothers are vulnerable to poor health outcomes, such as the risks of premature birth, low birth weight, and prenatal death, and the acquisition of HIV and other sexually transmitted infections. Teenage mothers diagnosed with HIV have to cope with the mistimed pregnancy, HIV diagnosis, and initiation into lifetime treatment during antenatal care. Adolescent mothers living with HIV also have poor outcomes within the prevention of the mother-to-child transmission continuum of services. In recent times, there has been a decrease in donor funding in supporting the fight against HIV due to the constantly changing global economic landscape. In this regard, I would like to urge all stakeholders to come together and help us achieve this goal in reducing the number of infections of HIV virus and more so teenage pregnancies. In order to achieve these targets, there is need for strategic investments that involve all stakeholders, both from the national and the grassroots levels. Ladies and gentlemen, despite challenges that continue to dog the HIV response, the Kenya government, on its part, has continued to focus on fighting HIV and AIDS. Kenya is credited among African countries like South Africa, Swaziland, and Zambia that have made remarkable progress towards universal access to ARVs that now stands at a coverage of 87.09%. It is also worth noting that there are more sophisticated treatment regimens now available to prevent the transmission of HIV. In this regard, I wish to recognize our able health personnel for resilience to ensure HIV and AIDS service continuity amidst emerging disease areas. Let us not lower our guard, but jealously protect the gains registered thus far. Sports activities, and in particular athletics, hold a special place in our national heritage, as it symbolizes national pride, upholding the country's long-standing excellence in long-distance races. The successful execution of the marathon races yesterday, in fact it's today, as an anchor of sporting activity to mark this year's World Day commemoration was indeed timely, as it served to rally the country towards ending this epidemic. The fact that Kenyans stand up in large numbers, men and women, old and young, for the race is a clear manifestation of our resolve as a country to accelerate our efforts towards the finishing line in ending AIDS as a public health threat in a timely manner. I urge all stakeholders to sustain public education and advocacy as a necessary strategy and tool to tackle HIV and AIDS and ensure a safe society where our adolescents and young people can grow to realize their dreams. In conclusion, I would like to ask all stakeholders to play their respective roles and continue the relentless war against HIV and AIDS. In fact, among youth and adolescents, again, I would like to thank the National Syndemic Disease Control Council and other stakeholders for organizing and hosting us on this special day. With these few remarks, I wish you all the best. Thank you. Asanteni sana.
And as the countdown